nurses of Ellis Hospital and all the registered professional nurses across the state who have dedicated their lives to caring for those most in need. I'd also like to take this opportunity to thank the community for your support of our members, especially during uncertain fiscal and political times. Our Nurses' Day is met with many challenges. Nonetheless, it's a struggle to find the time to provide the kind of care they know patients need and deserve. The Nursing Care Quality Act that went into effect earlier this month will help to ensure that nurses have the resources they need to deliver sound, efficient, quality care. We have confidence that facilities like Ellis Hospital will comply with the law and make available information that the public has a right to know when making decisions about their care and where to receive their health care. In addition to disclosure about certain quality indicators, such as the number of patients, falls, or patient infections, nurses now must explain how they determine the number of registered nurses needed on a particular unit during an actual shift, and also to talk about or determine the actual number of nurses assigned to patients on a given day, unit, and shift, how many patients that nurse is responsible for. Our members should be proud that their diligence and perseverance over the past several years, lobbying our legislature, educating others, and advocating for their patients, has resulted in this landmark measure, and that nurse staffing is being given the value and recognition it deserves. We have three additional...
Imagine being in so much pain that your physician admits you to the hospital, Ellis Hospital. Imagine waiting in the emergency room for 4 hours without anyone checking on you. Now imagine that during that time you are so ill, they are preparing a surgery room for you at 6 a.m. on a Sunday. Trust me, when you're rushed into surgery on a Sunday at 6 o'clock in the morning, you are extremely ill. You wake up in your room, you're in so much pain that you cannot call for help. Your family must leave your room to go find assistance for you. The physician has prescribed medication once an hour. However, your nurses cannot possibly meet that demand with 9 other patients to care for. Providing quality of care to each patient which they deserve is not possible. You hit your call button, your only source for assistance, and no one comes for 15 minutes, 30 minutes, 45 minutes, an hour or more. When your nurse finally arrives, she is so unbelievably stressed, she bursts into tears. All of this and more has happened to me in the past year. Unfortunately, I've needed surgery 5 times and have been admitted to this hospital 6 times, most recently in January. Throughout all of this, I've come to notice the quality of care the nurses are attempting to give the patient. But with these staffing shortages, they do the best that they can, and that is not fair to the nurses or the patients. Nurses have been told to take a day off because there's not needed. There's not enough patients. If there are not enough patients, why have all of these things happen to me? One person, one resident of Schenectady County. And why does she keep going back, you may be asking yourself? Because my physician is an attendant at Ellis Hospital. My physician is the only surgeon that I trust. My physician is devoted to my care, and my physician is able to care for me, even if Ellis Hospital is not. Will I be asking questions the next time I'm scheduled for care at Ellis? Of course I will, because under New York State's new disclosure law, I have the right to get the answers. Thank you.
All right.
For coming, especially our brothers and sisters from the other unions. My name is Barbara Crane, and I am the president of the National Federation of Nurses. I'm also a 34-year member of the New York State Nursing Association. This historic reform of our nation's healthcare system is now law. And over the next several months, the healthcare industry will be preparing the healthcare reform provisions. We've also taken the first steps here in New York to reform our healthcare system. Now that the Nursing Quality Protection Act, also called the Disclosure Act, has taken effect. Why does the state need a disclosure law? Because left to its own, the healthcare system has shown it will always try to force nurses to do more with less. We've heard long here at Ellis Hospital that unsafe staffing on their units is absolutely their top concern. According to the recent studies done by the American Nurses Association, more than 7 in 10 nurses say that staffing on their units and their shift is completely insufficient. And more than half say that they're currently considering leaving their positions because of inadequate staffing. Every nurse knows that when there aren't enough nurses on their unit, the care we can provide is compromised, and sometimes severely. In a survey of NYSNA members, nearly half reported that due to inadequate staffing, they felt they were unable to provide the level of care they believed their patients needed, and more importantly, deserved. And over the past several years, numerous studies have shown that there is absolutely a clear relationship between RN staffing and patient outcomes. Hospitals with more nurses on staff have fewer incidents of pressure ulcer, in-hospital acquired urinary tract infections, pneumonia, and post-op infections. It is well known that stressed and exhausted nurses are more likely to make medical errors. Understaffing has caused a decline in the quality of patient care. And despite the temporary easing of the nursing shortage due to the economic recession, with the delay in retirement and retired nurses coming back to the bedside, the nursing shortage will remain a long-term problem. The baby boomer generation will have increasing healthcare needs, and the current aging of the workforce will retire, and we don't have enough nurses ready to fill their shoes. New York State residents will not receive the quality healthcare they need unless the healthcare industry invests in a well-trained nursing workforce. So this is why New York State needs a disclosure law. The disclosure law will hold the healthcare industry accountable, and it is a step forward towards nurses giving their patients the high-quality care those patients deserve to receive. But a law is no good. It's no good just to win the passage. It's only the first step. Now, registered nurses and patients must take this opportunity to work together with the hospital industry as partners starting right here at Ellis to assure that our facilities are properly staffed so that we can continue to provide our communities with the excellent care they so rightfully deserve. Thank you.
Yeah.
Questions on point if there are any, and we will have people available to answer individual questions. Yes?
Considering the situation in the Schenectady area where we have 3 hospitals run by the same organization, is there really any competition then that might encourage Ellis to improve its staffing?
Absolutely. There's still a choice. There's still a choice where patients want to go within the community, the Schenectady County community, and there's choice to go outside of the Schenectady County community. And many residents in the county have chosen to do so by being competitive, by sharing what the ratios are, by making sure that the ratios of patients to nurses is significant in terms of delivery of quality of care, and being competitive with other area hospitals will keep our residents in Schenectady County and getting the care that they absolutely deserve. If they don't, patients are intelligent. They will go elsewhere for the care that they feel they deserve. Any other questions? Yeah. Well, thank you all for